Have you ever thought about traveling abroad, not just for holiday, but maybe for medical treatment? Or perhaps wellness?
It sounds a bit niche, maybe, but
Hmm.
actually, global health tourism is, well, it's booming.
Absolutely booming. I mean, the market value estimates are huge, anywhere from 15 billion up to maybe $50 billion a year,
Mhm.
and growing fast.
It really is a fascinating sector. It sort of highlights globalization in action, doesn't it?
It does.
People are traveling for, everything. Routine dental work, yeah, but also complex surgeries.
And often combining it with a bit of a holiday, too, right?
Exactly. They're looking for reliable care, professional service, advanced tech, high quality, and, this is crucial, usually lower cost than back home.
That combination is pretty powerful. So today on the deep dive, we're going to pull back the curtain on this complex world.
Uh,
We're focusing specifically on Turkey, which is really emerging as a significant competitor in this whole health tourism space.
mm.
And our mission really is to understand how all the different players in this industry connect, or sometimes how they fail to connect.
And what that means for the future of the sector there, the hidden dynamics, so to speak.
Exactly. And our insights for this deep dive come from a really groundbreaking research article.
It is quite unique. What makes it so valuable for us is the method it uses something called social network analysis, or SNA.
S&A, okay.
Yeah, it meticulously maps out the relationships, the actual connections between all these key stakeholders.
Wow.
And as far as we know, this is actually the first study of its kind ever applied directly to the health tourism sector.
So it gives us this unprecedented look at how the system really functions on the ground.
Precisely.
Okay, so let's define it a bit more. When we talk about health tourism, it's clearly broader than just, say, getting your teeth checked while on vacation. What does it really cover?
Absolutely. Broadly, it's any travel specifically for receiving treatment. So that includes medical procedures, obviously dental, surgeries, you name it.
Uh-huh.
But it also stretches to spa and wellness tourism,
Mhm.
and even specialized services like for disabled travelers or older adults.
Right.
And like you said earlier, the drivers are pretty consistent.
Mhm.
People want reliable, high-quality professional care. They often want access to advanced technology,
And at a lower cost, that's a big one.
a huge one, often significantly lower cost, and maybe even getting treatment faster than they could back home. And yes, if you can tack on a relaxing break,
Mm-hmm.
even better.
Makes total sense. So globally, who are the established players? Who's leading the pack right now?
Well, you got the sort of established leaders, places like in India, Singapore, Taiwan, Thailand. They're all known for delivering high-quality service, often at very competitive prices.
Okay.
But right alongside them, you see these really strong emerging competitors actively trying to grab market share. Think Brazil, Russia, and of course Turkey.
And the benefits aren't just for the patients traveling, are they? The host countries must see a huge upside too.
Oh, immense. It's not just about the money coming in, although that's significant. It hugely boosts the reputation of their healthcare institutions internationally.
Right, puts them on the map.
Exactly.
Yeah.
Plus, it helps increase what we call human capital. You get knowledge sharing, expertise development among the local staff. It pushes them to improve.
And the facilities themselves probably get upgraded too.
Naturally, it drives
Right.
investment in better facilities, better technology,
Hmm.
but the ripple effect goes even further. Think about all the related businesses.
Like hotels, restaurants.
Precisely. Restaurants, cinemas, fitness clubs, transportation, other tourist spots. It genuinely enriches the whole host community. It develops local resources, makes things more accessible for everyone.
So it really can be a win-win situation if it's managed well.
If it's managed well, yes.
And the study makes a key point here, doesn't it? Success isn't guaranteed. It really hinges on a few critical things.
Absolutely. Service quality is paramount, obviously. Then there's the ability of the businesses involved to innovate, to adapt.
And maybe the most crucial.
Collaboration. Really strong, effective collaboration among all the different parties involved. That's absolutely vital.
And that collaboration piece is exactly where this study gets really interesting, especially looking at Turkey.
That's right. It gives us some incredibly valuable and, yeah, sometimes pretty surprising insights to how things are working or not working in Turkey specifically.
So talking about Turkey, they've clearly been quite strategic about pushing into this market.
Mm.
The research points out, 15 years of significant improvements in healthcare quality?
Yes, over the last decade and a half, definitely.
Hmm.
And with a very clear ambition, grab a bigger slice of that global health tourism pie.
And they even have this Turkey Tourism Strategy 2023. It sounded quite comprehensive, integrating health with thermal spas, mountain tourism, winter sports, cultural sites.
They've definitely tried to create a joined-up approach on paper,
I know.
and they've backed it with specific legislation, too.
Right, like that Decree 663 from 2011.
Exactly. That laid out specific roles for the Ministry of Health in overseeing health tourism. Covered things like medical malpractice liability, rules for private hospitals, even tax breaks to encourage growth.
And there was another program, too, part of a bigger development plan.
Yeah, the Developing Turkey's Health Tourism Program. That was part of their 10th development plan, running from 2014 to 2018. And it was coordinated by a specific unit, SA Turk, operating under the Ministry of Health.
Okay, so it sounds like a pretty robust framework, at least in terms of policy. Now, who are all the players involved? The study mentioned quite a few.
It's a diverse landscape. The researchers identified 18 main types of stakeholders.
18 types. Wow.
Yeah, you've got public hospitals, private hospitals, specialized health tourism hotels, travel agencies, these intermediary organizations,
Okay.
insurance companies, transport companies, various NGOs, even universities.
Right. And the legislation points to the Ministry of Health as the leader, the main coordinator.
That's the official designation, yes.
Yeah.
The Ministry of Health is meant to be the lead actor, the coordinator of the whole system.
So a lot of different groups involved, but theoretically, a clear leader.
In theory. And that's precisely where this social network analysis, the SNA, becomes so revealing.
Okay, tell us more about SNA. How does it work?
Think of it like an X-ray for relationships within an industry. It's a way to map out and analyze the structure, the patterns of connections between different actors.
Actors being people or organizations.
In this case, organizations, hospitals, ministries, agencies, NGOs, etc. It shows you who's connected to whom and how strong those connections are.
So like you said, mapping the hidden dynamics, almost like seeing the social network of an entire industry.
Exactly like that. And SNA uses a few key ideas to help us make sense of these complex networks. One is density.
Density. Okay, what's that?
It basically measures how connected everyone is overall. In a big network, like Ankara's health tourism sector with 107 stakeholders,
107, yeah, that's a lot.
the density was actually found to be pretty low to medium, which kind of makes sense for such a large group. It just means not everyone is directly linked to everyone else.
Which highlights why certain connectors become so important, right?
Precisely. Which leads us to centrality. This tells us who's really at the heart of the network, who holds the key positions.
Okay, and there are different types of centrality.
Yes. There's degree centrality, which is simple. How many direct connections does an actor have? The more connections, the higher the degree.
Like being popular in the network.
Kinda, yeah. Then there's between-ness centrality. This measures how often an actor sits between other actors who aren't directly connected.
So they act as a bridge.
Exactly. They're like a broker. If an actor have high betweenness, they control the flow of information or resources between different parts of the network. They have influence.
Got it. That sounds like a powerful position.
It can be. And finally, there's closeness centrality. This measures how easily an actor can reach all other actors in the network, either directly or indirectly.
So how quickly they can get information out or receive it.
Exactly. Actors with high closeness are like broadcasters. They can spread information rapidly through the network.
Okay. Density, degree, between closeness. Closeness. Got it. So the researchers applied this SNA framework to Ankara.
They did, specifically to Ankara, as it's a major hub for Turkey's health tourism. They identified those 107 stakeholders, public sector, private companies, NGOs, universities, the whole mix.
And how on earth did they map all those connections? Must have taken ages.
It was meticulous work. They used a method called snowball sampling.
Snowball sampling.
Yeah. They started with the organizations they knew were central. The Ministry of Health, Ministry of Culture and Tourism, Ministry of Economy.
The big players.
Right. They surveyed them, asked, who do you interact with regarding health tourism? Then they went to those contacts and asked them the same question, and so on.
So the network snowballs outwards from the initial contacts.
Exactly. It took them 15 months, apparently, from April 2017 to June 2018, to survey everyone and map out all those ties.
15 months. That's dedication. Okay, so the stage is set. We know the players. We understand the SNA method. The big question, the reason for this deep dive really is, who is actually driving the bus here?
Right.
Who did this SNA analysis reveal as the real power player, the central figure in Turkey's health tourism network in Ankara?
Well, the findings are really, really insightful. And yeah, some were quite surprising.
Okay, let's hear them. What were people actually interacting about most often?
The top topics for relationships were things like legislation issues, common projects and agreements, and advertising and marketing activities.
Hmm. Okay, so focusing on the roles, joint efforts, and getting the word out seems logical.
It does, but what's interesting is what was low on the list.
Ah, okay. What was missing?
Investment and staff training were apparently very low down in terms of interaction topics between stakeholders.
Wow. Investment and staff training. That seems short-sighted for long-term growth, doesn't it?
It certainly raises a flag. It suggests maybe the collaboration isn't as focused on building future capacity as it could be.
Definitely a red flag. Okay, and what about the barriers? What did the stakeholders themselves say was stopping them from working together effectively?
This is where it gets really stark. The biggest issues identified were, fundamentally, a lack of coordination and communication.
Just basic communication breakdown.
Seems like it. Coupled with a lack of common goals, people may be pulling in different directions and insufficient information sharing.
So even if the policy framework is there, the actual day-to-day interaction is struggling.
That's what it suggests. Other issues mentioned were things like a lack of institutional trust, concerns about unsatisfactory legal regulations, maybe the rules aren't quite right, and a simple lack of financial resources.
It paints a picture of, well, a system with potential but facing some serious friction.
Exactly. Good intentions, maybe, but significant operational hurdles.
So did they have solutions? What did the stakeholder suggest needed to change?
Yes, and their suggestions directly tackled those barriers. They strongly push for developing common strategies and coordination platforms.
Makes sense. Get everyone on the same page.
Right. And ensuring effective communication, obviously. Plus, developing legal regulations that actually work better in practice.
Practical fixes. Anything else?
They also highlighted the need for providing financial incentives, increasing qualified personnel, tying back to that lack of focus on training, perhaps, and developing joint marketing strategies to make a bigger impact together.
Okay, a clear diagnosis and a potential treatment plan. Now, back to those central actors. Who did the SNA pinpoint as the most influential? The real star actors.
Unequivocally, the study identified the Ministry of Health as the star actor, the most central player by far.
Which makes sense, given its legislative power and coordinating role, right?
Absolutely. Its control over regulations and resources, like coordinating Say-Turk, just naturally makes it the most sought-after partner. Everyone needs to connect with the Ministry of Health.
Okay. Any other key central players?
Yes. The Ministry of Culture and Tourism came in second, which also makes sense, given their role in promotion and marketing crucial for attracting international patients.
Uh-huh.
And the Ministry of Economy was third, likely because they handle financial incentives and resource allocation.
Right.
Oh, and the Ministry of Finance also showed strong ties, particularly with the Ministry of Health, mainly due to working on joint legislative projects.
So, a clear hierarchy with the Ministry of Health at the top, supported by culture and tourism and economy.
That's the core power structure the analysis revealed.
But what about the other end of the spectrum? The weak links. Who wasn't well connected? Who were the isolated players?
This is one of the most concerning findings, I think, those intermediary organizations and travel agencies.
Yeah, the ones who physically connect patients to providers.
Exactly. Despite their absolutely crucial role, the study found they were not acting as brokers in the network.
Meaning
They weren't effectively bridging connections between other actors. They weren't fully integrated or actively participating in shaping the network's dynamics. It's a major missed opportunity for better integration.
wow. So a key part of the chain isn't really connecting the links. What about education? You mentioned universities were stakeholders.
Another significant finding. Education stakeholders. So universities, the Council of Higher Education, known as UK, and even the Ministry of National Education, ME.
Yeah.
They were found to be largely passive actors.
Passive. What does that mean in this context?
It means they had very weak ties, especially with the private sector stakeholders. The analysis suggests that health tourism education programs aren't sufficiently linked to the industry's needs, potentially failing to produce enough qualified staff.
So the training pipeline isn't really connected to the employers needing the skills.
Seems that way. The Ministry of Education, for example, was found to be hardly active at all in this network.
That's quite a disconnect. And were there players who were almost completely isolated?
Yes. Some NGOs, the study specifically names NGO 1, NGO 3, and NGO 15, and certain hotels, like HTH3, were found to have very few or even no ties to others in the network. One intermediary, IO7, had only a single connection, just floating out there.
So you've got these powerful central hubs, but also these significant pockets of disconnection and isolation.
Precisely. Though it's not all negative on the connection front. The study did identify some actors playing specific, positive network roles.
Oh, like what?
Well, the General Directorate of Public Hospitals, KHGM, was identified as a key broker.
Ah, fulfilling that bridging role we talked about.
Exactly. Effectively mediating information and communication specifically between the public hospitals and the main Ministry of Health. Very important.
Okay. Any others?
There was one NGO, NGO8, identified as a gatekeeper. So facilitating information flow, maybe controlling access slightly, but keeping things moving.
Right. And you mentioned broadcasters earlier.
Yes. The Ankara Provincial Health Directorate, AISM, was found to be a strong broadcaster. It had high centrality and high closeness scores.
Meaning it's well connected and can get information out quickly.
Exactly. It's well positioned to rapidly disseminate information and guide the various health tourism units across the province.
Okay, so zooming back out, we have this complex picture. Strong central ministries, specific actors playing broker or broadcaster roles, but also significant disconnects, especially with intermediaries and education. What's the big takeaway? Is the system working?
The fundamental challenge the study reveals is this. Despite having powerful central actors, despite the policies on paper, there's a significant lack of sufficient cooperation and integration across the board.
The connections just aren't strong enough or widespread enough.
Pretty much. For instance, they found surprisingly weak ties between the Ministry of Health and the Ministry of Culture and Tourism.
But their roles seem so intertwined. Health services and promoting tourism.
You'd think so.
Yeah.
But the connection wasn't strong in the network analysis. And perhaps most worryingly for growth, the study notes that promotional activities by the Ministry of Culture and Tourism have, and I quote, virtually ceased over the last 10 years.
Ceased, despite being the second most central player responsible for promotion.
That's what the research indicates. It highlights a major gap between the intended structure and the actual collaboration happening on the ground. And that kind of disconnect really hinders Turkey's ability to achieve its ambitious health tourism goals.
Wow. This deep dive has really driven home that point. Even in a booming industry like health tourism, with government backing and clear potential, success isn't just about policy.
Not at all.
It truly hinges on the relationships, the strength, the nature, the actual flow of communication and collaboration within that entire network.
Absolutely. Turkey has the potential, no doubt. But this study shines a bright light on these critical disconnects, areas that really need attention if that potential is going to be fully unlocked.
It really does. And it makes you think, doesn't it? This applies way beyond just health tourism in Turkey.
For sure.
In any industry where you need lots of different organizations to work together,
Wow.
how can those powerful star actors, the central players, do a better job? How can they use their influence and resources to actively pull in the weak links, the isolated players, to make sure everyone is genuinely pulling in the same direction, working towards that shared vision? What do you think is the most crucial first step for any sector trying to build that kind of robust, effective collaboration?